Traditionally, the most common causes of hepatitis as we think of it as hepatitis are 5 different strains of a virus. Hepatitis A and E are very prevalent, especially in third world countries. They are foodborne illnesses. Thankfully, hepatitis A and E are self-limited. They usually resolve on their own without much complication, although there can be some long-lasting effects from it. And then you have types B, C, and D, which are more blood-borne pathogens that are spread by contact with blood or through sexual contact.
We offer vaccination for patients with hepatitis B, and we provide preventative education in terms of decreasing risks in their lifestyles to try and prevent the disease. It's a dangerous disease to have because patients, for one, need to have the resources to come and get their labs and be diagnosed with hepatitis, and then be able to follow up with primary care, providing the education to them to understand the options for treatment and ways to prevent spread of their disease to other loved ones is important, patient education.
At Hunter Health, we make sure that we follow national guidelines on screening and testing individuals even if they don't have any symptoms at all. So all pregnant women get tested for hepatitis B, that's standard of care across the country, as well as hepatitis C. In addition, all adults should be tested for hepatitis C as well, at least once, and even more often if the individual is at risk based on their behaviors. I've had several patients go through hepatitis C treatment here at our clinic, and a lot of times they have been told in the past that there's no cure, which was true in the past. There was no cure for it until recently, or at least an readily available cure. There were some medications to help manage it, but they weren't necessarily easy to take and they had significant side effects. So now that I have had patients go through hepatitis C treatment, I think a lot of them are still in disbelief that they don't have to live with that anymore because they had been told for so long, this is something you'll have for the rest of your life and there's not much to do about it. So now that they know that their liver can work on recovering or at least stop getting worse, they're very thankful and grateful for the treatment that we can provide.